Research shows that forward bending with a load 3, 4, 5 times the amount of pressure in the low back. And that's one of the weaker areas of our body.
My dear Dr. Trumpi, how are you?
I'm doing great. How are you today?
Great. Thank you so much for coming on this podcast. I wanted to bring you on because I know you have so much experience in chiropractic world, and I would love for you to introduce yourself, tell the people who you are, what you do, and how you got here.
Well, first of all, thank you so much for having me on. I'm so proud of everything you've done and all your hard work. And I've seen
Okay.
all the effort you put in. So I like this so much. So thanks. Um,
Thank you.
well, my name is Dr. Mary Trumpi, and I'm a sports chiropractor because there's a couple different types of chiropractic. Um, I'm a certified chiropractic sports physician, which means I got my doctorate degree in chiropractic, but then there was extra certification, extra education that did extra training and allows you just to be able to treat the whole entire body, not just the spine, which I appreciate is the main focus of chiropractic, but trained in treating ankles, knees, shoulders, pretty much any type of sports injuries or injuries that people may get related to sports or not. So that's been a nice benefit because sometimes with just strict chiropractic or straight manipulation of the spine, there's less education if someone comes in with, let's say, a rotator cuff injury or a shoulder injury. So when it comes to me, I always wanted to be in the field of medicine of some sort. Always thought about it way back when, thinking about taking the MCAT and all the education. I wasn't really sure if I was prepared of all of that. And then I remember I was preparing to do a bodybuilding show and I was running through the kitchen, right? And I was going to get my stupid baked potato out of the microwave that was like, it's all beeping. So I run and I slip and I fall. And I pinch a nerve in my arm that the only position that was not painful was this. So I pretty much walked around like this for a month or two. And then I didn't even know chiropractic existed. And so found a chiropractor, went to her. She never fixed this, but I learned about chiropractic and how you can really treat the human body and all of the things that can go along with it, injuries, and you might deviate from the medical field, but be able to really treat people. So that was a blessing in disguise. Further along the road, I knew that what this meant. I knew how it could be fixed, but I was glad it wasn't at the time. So I had my bachelor's degree in human physiology and neuroscience at UC San Diego, then moved to LA. And it's called Cleveland Chiropractic College, but it's not in Cleveland. It's a Mr. Cleveland, so Dr. Cleveland. So went there, got my doctorate and a little extra education. And first of all, I had a great mentor who had a business that's similar to what I have now. His name's Dr. Alex Kaliakin. He had a medical doctor on staff. It was incorporated a medical corporation. So it allowed extra services to be able to be offered, a wider variety of treatments to be offered through insurance. And I really worked under him for a couple of years, followed his business model, and went out on my own. And so that's kind of the way my practice is now. It's I'm the owner, but there's a medical corporation. I have a medical doctor comes in once a month if they need, cortisone injections or anything, a quick little medical checkup, physical therapy, massage therapy, acupuncture, and myself as chiropractic. So that also was a blessing to be able to mimic that business model, learn a lot more. And I feel for me, it offers my patients and the people that come to my office a wide variety of treatments they can get under one roof. So that's kind of how I got here. And there's all this stuff that happened to get here,
Yeah.
but I'm here now. So, and over the years, I've treated a wide variety of patients. People come in with all kinds of injuries. And when I was really back in the day with the Gold's Gym, people in the heavy working out, I got a lot of bodybuilder athletes and, treated a lot of some of the professional athletes and professional bodybuilders back in the day. And that was also a lot of fun.
Dr. Trumpy, this is interesting. You mentioned that you did some work on some people from Gold's Gym. We're talking Gold's Gym Venice, the Gold's Gym, the Mecca, Arnold Schwarzenegger Gold's Gym. And you said you did athletes and bodybuilders. What are the typical injuries that someone like that comes to you for?
I would say a large majority of like people who are really heavy into weight training and heavy training, compound movements and all of that. Often it's a shoulder issue. It's an impingement. It's a rotator cuff issue. I almost see more shoulder issues than I do low back. I've had multiple people come in and the most common thing that I found from people who train heavy is a low back injury from deadlifts, heavy deadlifts. And
Mm.
I don't always think it's a bad form or it's a lack of wearing a weight belt. I just think sometimes forward loading on the spine is not the most healthy movement. Most, some people can do it all their lives and be very, very fine and be super strong, and the exact same person with exact same structure, exact same strength. They put 2, 3 plates, 4 plates on the deadlift machine and their back goes out. So it's not necessarily you train too heavy of a weight. Sometimes it's just people's structural integrity. Some of the most common issues there's a wide variety of people, the bodybuilder community, because I'm fine, and then they go right back and blow it out again. And then there's the wide variety of people who do a lot of athletic sports, and they come in with a shoulder, or they'll be like, how long you had it? Well, about a year. And I'm like, oh, okay, a year, okay. Then they've seen them twice. They're like, it's still here. I'm like, dude, you had it for a year. It's still here. I'm like, did you lay off? Well, no, I just did a little bit of bench. So that's some challenges that go with that.
You mentioned the weight belt. I've heard many things about the weight belt that bodybuilders or athletes wear when they're lifting. What is your take on them? Do they actually work?
I think I'm a supporter of a weight belt. I do think, especially if you're a pretty athletic person, you're not going really heavy, if you can do your deadlifts or leg press or movements like that, that's not excessive weight, and you're able to do an 8 to 10 rep, even with a heavy weight, and then maybe 8 or 10 reps is your max, then a weight belt is sometimes helpful, sometimes not. But if you're a person who's trying to really do a heavy amount, like a 1 rep max, and the weight's really extreme, then I'm a big supporter of the weight belt, especially on a deadlift maneuver, because research shows that forward bending with a load 3, 4, 5 times the amount of pressure in the low back. And that's one of the weaker areas of our body. If you're a heavy weight trainer lifting heavy, I'm a big supporter of a weight belt. I also have heard, like you say, oh, it'll make me weak. Oh, I'll rely upon it. But if you wear your weight belt on every single exercise all the way through the gym, perhaps that could make you be more dependent on it, a little bit weaker. So that wouldn't be my best recommendation. But if you're lifting some heavy weights, especially bent forward, bent over rows, on the Smith rack or weights, like wear a weight belt. It'll protect you, even if you think you're super, super strong.
A couple of questions. One is, what are the typical injuries in men and what are the typical injuries in women?
I almost can't think it's a gender thing or a male-female thing. I feel in my population, my patient base, we're about 50 women, 50% women, 50%, 50-50 male, female. And it's very, very similar.
Okay. So
I do find, not to stereotype or categorize, but I do find sometimes men, because you guys are strong, may wait a little longer to get treatment for an issue. And that often becomes, when we're 18, 20, 30, we get an issue or an injury and it goes away. Remember when we used to heal in 2 weeks? And usually, with that experience, especially if you have an athletic background and you've had injuries, if you just kind of take it easy, rest a week or two, it usually goes away. And so with that being someone's background, I've had people wait a month, 2 months, 3 months. They keep thinking it's going to go away. And there's no fault in that, but sometimes they'll get 8, 10 months, a year, and they're just working around the issue, which we know prolongs their healing. So I do find men may have a tendency to wait a little bit longer to get an area checked out.
Now we can come out of the bodybuilding, I guess, category. One of the questions I have for you, obviously there are, people take steroids, people take substances in order to get strong. And then sometimes, what have you seen, without naming any names, obviously, where you see an athlete coming off of it? Are there injuries that come with that? What's the dynamic of that world?
It's a wide dynamic in the bodybuilding world and the heavy, competitive world. There are performance enhancements drugs, and it's kind of common in the gym world, especially if you're at that level. That now there's new things called peptides that are very helpful. I have seen it's almost like the emotional and the psychological things that happen when, not necessarily women, because I don't have that big of a population, but when you see your friends or your guy friends and they've taken all their stuff and they're, 20, 30, 40 pounds heavier of muscle than they were. And then they're smart enough to know to maybe go off the cycle and all of a sudden 20, 30 pounds less. And I see their, not always, but sometimes when you see someone's body shape changes like that, and I would do the same thing. It's like almost if I gain 20 pounds of fat, I'm not longer confident. But you see not a dependence upon performance enhancement drugs, but like what it happens when you're no longer that big, strong guy. Now you lost 20, 30 pounds. You're not wearing your tank top. You're coming in here with your baggy sweatshirts, and it's a topic of conversation like, oh, I feel real small. But in the real world, they're still a beautiful, like muscular, big person. But it's interesting to see, especially if you're in that environment of like everyone's big and yoked, and all of a sudden, oh, and now they're not pressing the same amount of weight, and they just barely get enough time. And now they're like, now they go back on another cycle and they get their weight back up, and then they're all confident. And so when I see that in my friends and people, you can't talk to someone about how they feel, but it's interesting to see like, oh, our identity and everything that we are, when our identity is about our body and being strong and fit, and then all of a sudden you're relying on this thing, but you don't think you're relying on this thing until it's gone. Then you lost this weight, you're not as strong. It's interesting to see the psychological and like emotional thing that go with people.
It's funny you mentioned this because there was a joke, when they come in, like you said, overweight and a little bit more chubbier than before, and it's oh, I'm off season, I'm off season. Off season. Oh my God. I deal with mental health as well in the entertainment world, in the fitness world, and the business world. And you brought that up that people feel a certain way. Do you think from body composition perspective, not everybody's gifted like Arnold Schwarzenegger, right? There's different types of body shapes and sizes. And some of these athletes, they're strong in one area and not strong in the other. Is that something that you've seen where they're overcompensating and then injury happens, or is that not what it is?
I think that's a very true statement. Like we always weight train, we love to weight train, and it feels good, and that's kind of what we're used to. But it's a very linear exercise. So if I'm doing this, I'm linear. I'm doing this, I'm linear. There's not rotation. So sometimes if people are not doing the recovery or the rehab or putting extra movements in their body, that's when injuries can occur. For example, when I see, this is not always the case, but if you're never doing a rotation or you're never doing a movement like this, and then all of a sudden you're like, oh, I'm going to go grab this kettlebell from the floor, I'm going to swing it up here. But if this fascia and this muscle is never really lengthened in that area, and it comes down and it connects to your low back or your shoulder, you may be able to do that movement. But I think that's when people start having injuries, when they train specifically in one plane and they don't do other lateral movements, rotation movements, lengthening movements, and suddenly they do something that's their body's not used to. That's when I find injuries can occur. One of the things that I find in today's world that maybe have been different from me growing up is there's been a big focus on recovery, and that we never had growing up. Like in the 80s and 90s, I'm trained working with the bodybuilders and et cetera, and like everyone's just muscle bound, but no one ever got the deep tissue work. We didn't know about foam rollers or stretching, might do a few jumping jacks and that's about it. And today's people, I have a wide group of young people. They come in every week, every couple of weeks, they get the deep tissue massage, they get a stretch routine, they have a stretch routine they do in the morning, they do the Normatec things, they do the little movements for the ankles, wrists, knees.
What's Normatec for people that don't know?
A Normatec is it's a brand name for a machine or a therapy. They have it for legs, arms. It's a long boot. What we have arms and legs, but it's a long boot that slides on the legs, and it's connected to it like a little compressor. It's like a compressive style of massage that'll pump up the legs, relax, pump up the legs, relax. Similar to lymphatic drainage, similar if you were laying in the hospital and the things they put on the legs to stop you from having blood clots, the way it does that. That's a great recovery tool that people can use, especially if they train their legs a lot, the people who are long distance runners. And, it doesn't really force lactic acid out, but it does help the circulation by the pumping and relaxation. It's almost like your legs feel like they are fresh and recovered. Normatec's the brand name, but it's kind of the pioneer in it. There's arms, legs, hips, but we have it at our office. And if your legs are really sore, if you do that once or twice, it feels pretty good. And I've seen people have their own at home.
For people who have issues with blood pressure, is that recommended or how does that work?
Thanks for asking. That's a good point. We like to take their blood pressure first. We want you to have a normal blood pressure to get on there. If you do have high blood pressure, I would not have you do that. It's
Hmm.
unlikely it could cause something, but we
I
just
see.
check their blood pressure first. So that's always good.
Interesting. Very interesting. You wanted to show me your skeleton.
Would you like to see my spine? All right, so here's your spine. Now I'm going to give you a little rundown version on it. It's like a Cliff Note version, but so here is your spine. That's from the side, okay? What we like to have in the spine, here's your head. It would be nice if there's a little curve, mid back curve, and low back curve. Those are allow the weight of the head, and when you walk, kind of to distribute the weight and the stress of the spine. Let me show you a little bit up close about the spine. Now, the spine is made of bones and discs from the top to the bottom, and it goes bone, disc, and they're everywhere. The discs are a big, thick, hard, cartilaginous connective tissue type of thing. It's a big, thick structure that keeps the bones off the nerves, okay? So the nerves come out of the spine, deviating to chiropractic. The chiropractic idea is if there are misalignments in the spine or the spine doesn't have the proper alignment, even a slight misalignment can put a little pressure on the nerves that come out of the spine. For example, here's my spine. In the neck, the nerves that come out of the neck, they can feed the brain. Besides the nerves in the middle of the neck that go down the arm, they feed all the muscles and etc. For example, all the nerves in the mid back, they supply cardiovascular, respiration, digestion. And so one of the healing properties of chiropractic is if you get a spinal alignment on a regular basis or keep your spine aligned, it can keep the nerves fully flowing at 100%. So whatever organ that nerve is supplying is then getting 100% nerve flow. It's almost like if you had a hose and you got a little kink, and you're only going to get like a little bit of water coming out. Let's say people who are sitting at their desk, always compression here. Sometimes it can add to digestive issues or anything where these nerves are, just the compression in here. So the chiropractic of keeping the spinal alignment is if you keep all the nerves fully open, all the organs that they serve will function better. Back to the spine, okay?
Wow.
So people talk about having, oh, I slipped a disc, but they think that the disc slips. And they're like, can you push it back in? And I'm like, well, it doesn't really slip because it's all stuck together. But what happens, people, oh, I did have a disc bulge or a disc herniation. What that is when a disc gets injured or inflamed, it will bulge out, which means pretty much swelling. For example, that is a fake disc bulge. See the red thing? This disc has bulged out. It can compress this nerve. For example, spine, again, back of your spine, the sciatic nerve comes from 3 levels in the low back. So if you're here, here's the low back, L3, L4, L5, those make nerves. They go like this. They go down the middle of your buttock all the way down to your legs. So that's why if you have a disc that's bulged, herniated just means it's worse, and it's sitting on this nerve, that's how you can get really bad sciatic pain. So a disc bulge, herniation, they're all just variations of the disc is injured, swells out, pinches a nerve. Same thing up in the neck, okay? The middle of the neck here, these 3 nerves go down the arm. So if you have a disc that's been injured, it's bulging, swelling, and pinching this nerve, you can have really bad pain that goes down the arm. And as a doctor, depending on where your pain pattern is, then I would know which level is being irritated. For example, C5, which is cervical vertebrae, number 5 in the middle of the neck, it does more of a bicep, forearm thing. 6 and 7 would be tricep and these fingers. So same thing in the low back. Depending on where you have a pain pattern, I would know which area is the most irritated. So when I speak about, when I talk about deadlifts, for example, here's your spine. This is a pretty small structure, right? And even if you're a big, strong person, these discs down here, L4, L5, and L5S1, they take the most brunt when you are sitting. So if you're doing a super heavy bent over row and you're not having support and your back is bending, that's when you can really have a tendency to injure the discs in the low back from heavy deadlifting movement. That's why people will come in where they blow out their back. They're like pulling a sofa or pushing something heavy. But one of the more interesting things is people will come in and they're like, it's not the heavy movement. It's I picked up a pencil and I couldn't move. I went to put on a sock and I can't move. And my theory or my idea in that situation is that the that the basic structure of that spine has had some pressures going up to the point that it's weakened. And it wasn't the I'm picking up a pencil, blow out my back, is I'm picking up a pencil. And at this point, my spine can no longer handle that movement. Or it's the person who's only been linear, then all of a sudden they're like, I got to get that. And they do a quick movement in an area that they're not used to, all the muscles and everything attached in here, and that can blow out your back. So it's kind of people are like, why would that happen? I just put on a sock. It's because something's built up to that point to where something isn't strong enough to handle that day-to-day activities. So that we address with the right type of rehab, core strengthening, lumbar spinal stabilization.
How much does strength training help with the spine and the nerves and the ligaments?
I think it's helpful. It's great. I think strength training is key, especially as we start to get older. As we get over 40, we all will lose muscle mass. We're going to start losing muscle mass every year until we die. So I think strength training is super important. Even if you get a little bit older, you may be plagued with some aches and pains that you can't train like you used to. Those 2, 3 times a week, do some strength training. Women who are prone to osteoporosis and lack of bone density, we know strength training is good. Even you got little dumbbells, just do them at home, things like that. I think it's key for longevity and spinal health for sure.
This is so informative. Tons of questions, but I'm only going to ask you a few. When somebody sits too long behind the desk working on and then what are the usual injuries they come in with?
I was just going to talk about that because it's very similar. Because I feel for like people like yourself, you work, but then you sit and you edit, and you write, and this and that. Like we think we have good posture, but pretty soon we're gonna slump down. And it's almost like the same thing with the spine. Is you think you're comfortable, there's not in pain like that, but if you really are, the posture slumping here starts putting pressure in the low back. With this, what happens, especially people who are just sitting all day and their jobs are stressful, they're typing and they got multiple screens, is that the postural muscles stop working. They don't really stop working, but every muscle has a perfect tone. So this would be great. Sometimes they're too tight, sometimes they're too loose. Either too tight or too loose causes pain, dysfunction, spasms, things like that. If you're in a forward position, like bad posture on your computer, and you go and you sit in your car and you go drive, the mid back muscles, rhomboids, low traps, they're like, oh my gosh, he's too forward. I can't hold, I'm gonna let go. And they stop holding you back. Your brain gets retrained to think, oh, I think she wants to be here. Pec muscles shrink, pec muscles will tighten, pull you back. And then all of a sudden, our posture is this. And the person that comes in and they're like this, and I'm like, shoulders hurt. I'm like, well, yeah, dude, you try to do a shoulder press, your shoulders here. I have this story. This guy comes in, he's probably 25, and he's like, oh man, my shoulders have hurt like 2 years. I can't do any overhead press. And I need MRI. So I take him to the gym, right? He's got little dumbbells, and he's like, ah. And I'm like, okay, stand up straight. And he's like, what do you mean? So I'm like, show him how to do right. And he's like, oh my God, it's gone. So just having the upright posture, ball and socket. But for 2, 3 years, he thought he needed surgery. He was just pressing like this. So That's what bad posture can do.
So
So
for the form of the workout is super important, right? The alignments in the workout. A lot of people when they do like chest press, they think they're doing chest press, working the pecs, but they're really working their shoulders, right?
correct, yeah. So much form with that, and people think that good posture is. And another thing is when it comes to sitting at the desk. Sorry to deviate. Sitting at the
Yeah.
desk, right? Often, if you have multiple computer screens, and let's say they're here, right? Or if there's one here and one here, I'm like, which one do you look at the most? They're like, this one, and I'm like, well, the side of your neck hurts. They're like, oh, but people don't think that because they think that they do this or they think that they do this, but they don't. I'm like, well, maybe you just move your screen. So the most ideal position, if you have multiple screens, if you're 80%, 20%, keep 80% here, 20% here. If you're 50-50, try to go here. And sometimes it's not even, but even if you're doing this all day, in the middle of your day, when you think you're doing it, see what's happening. See if you really are turning, or see if your
Mm,
torso is turning, and that kind of puts a good awareness of your
mm.
body.
Interesting.
And
Interesting.
when it comes to posture, right? So everybody, I'm like, get good posture. People all do this. They pull their shoulders back. But the idea about posture, it's more about lifting your chest, and you don't, but it's not this. Like we see the guys like this, right? It's. I always tell people you have to think about the muscles that are in your mid back, rhomboids, low traps. Their job is to kind of like pull and pull you down. So I tell people, think about taking your shoulder blades and kind of like putting them in your back pocket. And so when you have better posture, these shoulder joints don't move at all. It's just stick your chest out. And then it's weird because we think it looks weird. Men and women, you're like, oh, do I look like I'm sticking out my boobs, or do I look like I'm trying to be all tough? But it looks normal. Like, this is how I want to stand, but this is good posture. But it looks normal. But in your head, it doesn't look normal. So one of my recommendations, I tell people, well, hey, every time you're standing in line at a grocery store or something, think about that posture. Don't do it all the time because you'll get fatigued. But if you're aware of this posture, what it does, it has a tendency. So if I just do this, this does not change. If I lift my chest, watch how it brings my head in alignment with my shoulder, chest. These
Mm.
guys are free. And then it stops taking pressure on the neck. So I tell people to practice that, even at the desk. Let's say they're fatigued and they're this. I'm like, just take a second and like practice it. Because you need to practice good posture, both sitting and standing, to train your brain to do it both sitting and standing. Because sooner or later, your brain's going to be like, oh, I remember I should stand like this. It might be 2 minutes a day it's going to remember. Then sooner or later, it's like, brain's like, oh, I can do this 5 minutes a day. And over time, you can have a bad desk job, have stresses, and overall have a little better posture.
Dr. Trumpi, degenerative disc, right? What do you do about it? How do you manage it? What's the right approach for that? Because some people have it. It happens with an accident, something gets chipped, and it stays with you pretty much for the rest of your life. What are your recommendations?
Okay, degenerative disc disease, people call it DJD, and in a layman's term, it really is arthritis. But people get really afraid of hearing the word arthritis. But in my world, itis just means inflammation of. But in other people's minds, they think they're going to become debilitated and be in a wheelchair and never be able to walk again. So degenerative disc disease means that the discs over time have degenerated. So when we are young, all of our discs are really they're cushiony, they're supportive, they're like a fresh donut, right? You're like, oh, that's so nice, right? A couple of years go on, what happens is they stop being as cushioned, they are less hydrated, and they become dehydrated. And so they become a little flatter. They're no longer as cushiony. So degenerative disc disease, that's when the discs, instead of being nice and cushiony, they are get flatter. When they get flatter, this is an enlarged version of what we had. This is the this is the disc, these are the bones, and this is where the nerve comes out. So if this space gets smaller over time, the area where the nerve comes out is smaller. Sorry. And by the way, this is what happens if you have a disc bulge. Oh, go this side. This is what happens when you have a disc bulge. See that
Oh
thing?
my God. Yeah, yeah, yeah.
So that's a good disc. That's a bulging disc pinching this nerve. So degenerative disc disease is some people, as we all get older, we're probably all going to be prone to having some degenerative disc disease because that's kind of how we age. Some people can have a x-ray that looks all mangled, there's no space, and they don't have any pain, which is interesting. Other people have that same spine and it's very uncomfortable. They have chronic pain, they can't manage it. If someone x-rayed you and seen MRI, like, oh, you got multiple levels of degenerative disc disease, one of the most important things you can do is keep mobility in your spine. You know, not the heavy lifting, not the sprinting, not all the hip movements and compound movements, but mobility in the spine, lengthening of all the muscles that are around the spine. And because if sometimes when we've had an injury, we've had a bad back, we've had surgery, we become really afraid to move. We become afraid to do the little things that we are afraid is going to set us back to that major pain. So our world becomes smaller, our activities become smaller, we become fearful. And I've done it myself, a lot of my friends have done it where like, I don't want to do that because I certainly don't want to go back to that level of pain. So I'm going to sit on the stationary bike forever. That's also a good thing. But I think being aware, there's core exercises and exercises that are like lumbar stability exercises that on your spine, if you really strengthen everything that's around the spine and back here, and you have an issue with that DJG arthritis in your spine, you're going to be able to manage your discomfort a lot better. And it's the little tiny movements that aren't fun. They're not going to give us abs. They're going to be boring, but it's if someone found a routine, there's even amazing things on YouTube right now. You do 3 times a week, 10 minutes, that really focuses on those. You can have a tool for yourself to help yourself feel stronger. If you feel a little tweak coming on, you're like, oh yeah, Dr. Trumpi said heat, ice, blah, 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 blah. And kind of go through a little protocol that you can help yourself feel better.
For people who don't know, and sometimes this gets confusing, you showed me the bulging disc. Does the icing and the heat, how do you put that on? When do you put that on?
I know it is really, I respect both modalities, and acupuncturists really feel that heat's the best because it brings blood flow and circulation. I agree with that. But my approach is if you're having a lot of pain and it seems to be coming from a spinal issue and MRI or something shows you have a big disc bulge, then ice is going to help. Because if you have that disc that's bulging, in a way, it's a swollen part of the disc. Heat feels good. She's like, oh my God, I can move. But you need, in my opinion, especially if you're in a lot of pain, icing is going to take some of the swelling out of that disc. If you only do it once or twice, it may not make a big difference. That some people will be like, oh, I iced for 2 days, it didn't help. But if you're in a pain, chronic pain or acute pain pattern, then you kind of need to use the ice for a little bit of time because you'll ice it, swelling will come down, you walk around and come back out. So over time, 5, 6 days, if you can ice it, get some of the swelling out. Always great to alternate some heat. People ask which is better if you did them both first or last. Sometimes I think if you heat the area first, 15, 20 minutes, gets blood flow, gets circulation, everything gets looser, it feels good. And then put some ice on it for another 10. It'll kind of stop any of your body's natural response of like, hey, there's too much blood flow. So heat 15, 20 minutes, ice 15, 20 minutes afterwards, kind of a good baseline. Going back to DJD, degenerative disc disease and arthritis, if you're a chronic achy person because your neck's always achy and your back's always achy, those are the people that seem to really respond nicely to heat because there's no chronic inflammation. Maybe the spine's just a little bit more compressed, everything's tighter. So get yourself a microwavable heat pack if you microwave stuff or whatever. And, if your neck's stiff and achy, if you're kicking it at home in the evening, put some heat on there. It'll help you feel better.
How long do you ice and how long do you heat?
I would say like 20 minutes max. That's why I like the ice packs because and ice will be done in about 20 minutes. Sometimes people who like to like sleep on a heating pad or have a heating pad all day, sometimes it causes the opposite effect because your body is smart enough to know like, oh, that's warm. I'm being burnt after so much time. And then it's the opposite response. Your body's like, oh my gosh, there's too much. Oh, then it starts sending other things there. And it's almost like it's a pattern. So continual heat is not my recommendation.
And when it comes to ointments that people use, I know you used some ointments before when I came in and saw you. And what are those? Are those recommended? What do those ointments do? They relax you. What is it that it does when you're in pain somewhere and you put some kind of cream or ointment on that makes them? I guess it's icy hot. What is that exactly?
You know, some of those are really great. Like some, especially if you're having a rough day and you need to get through something, there's different topicals. Some have an aspirin based thing and it just kind of like stops the pain from happening. With the menthol, like the icy hot and the things that makes you feel kind of cool, it has a tendency to increase blood flow to the area. Sometimes there's some analgesic topical, components of that which temporarily stop the pain. I've used a wide variety of different CBD lotions that some patients have really long-term great response. So it kind of depends on the person's issue, but the right type of products that some of the CBD products, I have multiple different companies that are good. I've seen people really, really like them. And, so I've had people who really have bad knees and they're waiting for surgeries. They would come buy the cream, rub them on their knees every day and get through their day and feel pretty good. So I,
Awesome.
I think they're great. They're all temporary. They're not going to fix anything, but they'll definitely help you feel better.
Well, listen, this has been so educational. Dr. Trumpy, your information and the stuff that you share with us is pretty tremendous, very insightful. So I want to thank you for sharing, and I want to thank you for coming on the show. And I would love to bring you back again soon so we can explore because there's a lot to explore here.
Thank you, Stephen. I appreciate being on, and I had a really great time, and I love being a part of your show. And I look forward to coming back. And if people have an idea of what they want to hear about, and let them know, and we can give you some information.